Really exciting news. CHRISTUS Mother Frances Hospital, Tyler, is awarded the nation's top stroke center. And their stroke program coordinator, Mari Carmen Kennedy, is here to tell us how they got this big honor. Hi. How are you?
Good. Thanks for having me.
You're so welcome. This is exciting.
Yes, it really is.
So when did you hear about this?
So we've been working on this program for about a year and a half. It's a big undertaking, and it took a lot of people to get this to work, but it was so important for our community. And there's just about all of Northeast Texas, none of us had a comprehensive stroke center, so we were having to send our patients to Dallas and other metropolitan areas to get them the treatment that they needed for stroke.
Yeah, exactly.
So now here in Tyler, Texas, we can offer that.
That is so great.
Yeah.
What does this mean for your patients here in East Texas?
It means you get to stay closer to home. It means you get top of the line stroke care right here at home. We've been a primary stroke center for about 10 years, and there's several of those around, and those are really great. You don't want to bypass them. They do still have immediate capabilities of treating patients with stroke, but it's so time sensitive that for patients with large strokes or large vessel occlusions, what we might call them, they would need to be transferred to us for a higher level of care, and possibly where we can go in like a heart cath and pull the clot out of their brain, thus restoring blood flow to their brains.
So I won't ask you any statistics or anything. I know that's kind of hard to remember, but are strokes pretty common here in East Texas?
They are. We are in the middle of the stroke belt, like the buckle of the stroke belt.
Really?
So we have a really high incidence of stroke. Stroke is still the 5th leading cause of death and the highest cause of disability in the U.S. So we have a lot of work to do. Time is still brain. We still have to get to the hospital really quickly, not to ignore your symptoms or downplay them. Call an ambulance. Those are all still very important things, but luckily we get to be able to treat you guys here, and you know, staying close to your family is so important when you're trying to heal from such a major event.
Oh yeah, it is. I mean, family is the whole reason you get through these things in these times. So what, you know, it's not like this is a part of life, you know, having a stroke, but are there things that you recommend that we can do to prevent getting a stroke?
Sure. Always diet and exercise will cure it all, right?
Right.
Except for when you have high blood pressure, diabetes, high cholesterol. Atrial fibrillation is an irregular heartbeat that can cause strokes. So going to your doctor regularly, getting those visits, and make sure that the medications that you have been prescribed are working for you, and you know, getting out and exercise, and hopefully the rain will stop long enough we can walk outside for a minute.
I know. Wouldn't that be nice?
It would be good.
Thank you so much for joining us,
Absolutely.
Mari Carmen.
You're very
it was
welcome.
Great to meet you.
Thank you.
Well, speaking